An influenza outbreak has gripped the United States. At least 11 million people have contracted flu. 5,000 persons have lost their lives. And at this juncture, the decision by the U.S. government has taken everyone by surprise. Well, the U.S. Department of Health and Human Services has reduced the number of vaccines recommended for all children. While universal immunization catered to 16 diseases earlier, only 11 diseases will be covered now. Vaccines for hepatitis A, hepatitis B, rotavirus, meningococcal disease and influenza are now optional. Patients can take them after consulting their doctors. Now, it is worth noting that the COVID-19 vaccine was already made optional last year. Reacting to the US President Donald Trump claimed that the new childhood vaccination list is rooted in the gold standard of science. This decision was taken by studying the vaccination pattern of 20 countries across Europe, Australia and Asia. The Trump administration reasoned that US recommended more vaccines for children than any of these nations. And it concluded that vaccines are not necessary in case of hepatitis A and meningococcal disease owing to the low incidence rate of 0 to 100,000 persons. As far as rotavirus is concerned, the government found no risk of mortality. Now, when it comes to influenza, he stressed that there is no evidence to show efficacy of the vaccine. For hepatitis B, it stressed that a vaccine is essential only for high-risk groups. This move has been flagged by medical experts. Dr. Robert Hopkins, medical director at the National Foundation for Infectious Diseases, opened that many vulnerable children will find it difficult to access the vaccines, which have been made optional now. Now, he also claimed that data and expert evidence and advice have been ignored. Meanwhile, the American Academy of Pediatrics dubbed it as a dangerous step.
It increases confusion, it increases doubt in the tools that we've had available to us to protect our children for decades. And that's going to cause more people to have doubt about what's the right thing to do to protect their children. And that's a catastrophe as well.
Now, US has claimed that excluded vaccines shall continue to be covered under insurance, but concerns remain over the confusion created by this decision and whether it can lead to an increase in preventable diseases.